Hello everyone. As we all know, majority of patients with Sjogren syndrome present with Zika symptoms, but these are very subjective and some patients may not perceive milder involvement of salivary and lacrimal glands. Hence, it becomes important to objectively assess the involvement of these glands. In this video, we'll be discussing about the various methods of assessment of salivary gland function in patients with Sjogren syndrome. The common methods that are used to assess salivary gland function are salilometry and salivary scintigraphy. We'll be discussing these two methods in detail subsequently. The other methods that are used to assess salivary gland function are salilochemistry, that is the chemical analysis of the saliva, saliography, it is a method of parotid gland radiography that involves dye injection into the parotid gland duct and subsequent imaging of the parotids. Ultrasound is commonly used to assess the salivary gland tumors, while MR saliography is a non-invasive method of studying the salivary glands. Clinical examination of patients with Sjogren syndrome provides clues regarding the hyperfunctioning salivary glands. Parotids and submandibular glands may be enlarged and tender in these patients. They also have a decreased oral salivary pool as evidenced by dry oral mucosa and absence of saliva in the floor of the mouth. They are also predisposed to dental caries, especially in unusual sites like the anterior mandibular and the maxillary tooth. They can also develop oral ulcers and erosions, and the tongue may be fissured, erythematous, and dry. Salilometry is a measurement of salivary flow. It is a widely used method in the diagnosis of xerostomia. There are two methods of performing salilometry. First is the whole saliva collection that measures the salivary flow from both the major and the minor salivary glands. The second method is the selective cannulation of the major salivary glands and measuring the salivary flow from that particular gland. The whole saliva collection could be stimulated, where salivary secretion is augmented using gums or candies while performing the test, or unstimulated. With regards to Sjogren syndrome, unstimulated whole saliva collection method is commonly used to assess xerostomia. The unstimulated whole saliva collection is a very simple method and can be performed with few easily available instruments and does not require expertise. The instruments that we need to do a test are a glass funnel to collect the saliva, a 15 ml graduated centrifuge tube to measure the saliva, and a stopwatch to note down the time. Before beginning the test, the patient should be informed about the aim and the procedure of the test in detail. The patient should be instructed not to take food or beverages like coffee and cool drinks at least 1 hour before the test. The patient should be well hydrated and water can be consumed till the time of the test. Just before the test begins, the patient should rinse their mouth several times with distilled water and then relax for 5 minutes. Once the test begins, they should be told to minimize movements of the head and keep their eyes open while performing the test. Stop clock should be set for 5 minutes, and just before starting the clock, the patient should be asked to swallow the saliva present in the mouth. The patient should lean forward over the funnel and allow saliva to drain into the funnel as shown in the picture. The patient should be informed not to swallow saliva during the test period. At the end of 5 minutes, the patient should collect remaining saliva and spit into the funnel. The amount of saliva collected in 5 minutes should be measured in milliliters. While interpreting the results, saliva flow should be expressed as ml per minute or gram of saliva per minute. In normal individuals, the unstimulated whole salivary flow will be 0.3 to 0.4 ml per minute, and salivary flow is decreased when the flow rate is less than 0.1 ml per minute. For stimulated whole saliva collection method, flow rate of less than 0.7 ml per minute is considered as abnormal. Salivary scintigraphy is a non-invasive technique which assesses the function of major salivary glands. Those are the parotids and the submandibular glands. Scintigraphy provides information on both the parenchymal and the secretory functions of the salivary glands. However, this method is not widely used due to its higher cost, need for experts, and the use of radioisotope material. Coming to the technique, 2 ml of radioisotope, commonly the technetium-99 pertechnetate, is administered intravenously. The isotope concentrates in the parotids and the submandibular glands with maximum accumulation noted around 15 minutes after isotope administration. Then the patient is made to lie between the detectors of the gamma scintillation camera. The detectors of the gamma camera captures the emitted radiation from the salivary glands and the images are recorded every 30 seconds. After 15 minutes, lemon juice is given orally which will stimulate rapid secretion of the isotope from the salivary glands and images are recorded for another 5 minutes. A total of 30 images are recorded over 20 minutes. These are the images captured by gamma camera in normal individual. The parotid and the submandibular glands does not show uptake of radioisotope at baseline, and subsequently the isotope starts to concentrate in the glands with maximum intensity noted at 15 minutes. This indicates the normal trapping function of the glands. After lemon juice is given at 15 minutes, both the glands should decrease in intensity of emission over the next 5 minutes. This indicates the adequate secretion and drainage function of the glands. These are the images captured from a patient with Sjogren syndrome, and we can observe that the intensity of isotope uptake and secretion after stimulation from the parotids and the submandibular glands are decreased. This indicates the hypofunctioning salivary glands in these patients. The computer output will be in the form of a graph that is shown here. This is a graph obtained from a normal individual. On the y-axis is the radioisotope emission intensity and on the x-axis is the time in minutes. As we can see, maximum intensity of emission is noted around 15 minutes after isotope injection. This is the Tmax value. The Tmax value indicates the adequate trapping of the isotope by the salivary glands. After stimulation of the salivary glands, the isotope is secreted and that is reflected by a fall in the isotope intensity. In this patient, the value decreased from a maximum of 50 counts per minute to that of 15 to 20 counts per minute at 20 minutes. This indicates adequate secretory function of the glands. For comparison, a graph obtained from a patient of Sjogren syndrome is shown on the right side of the screen. Here the Tmax value is only 30 to 35 counts per minute and there is no appreciable fall in the intensity after stimulation with lemon juice. This indicates abnormal trapping and secretory function of the salivary glands. To conclude, clinical examination gives vital clues regarding salivary gland hypofunction in patients with Sjogren syndrome. Unstimulated whole salivary flow measurement is a simple technique and less than 0.1 ml per minute is abnormal. Salivary scintigraphy is useful in assessing the parenchymal and the secretory functions of major salivary glands in a non-invasive way.